Welcome to NC Political Tea, the show where North Carolina's political scene gets served piping hot, grassroots style. We're here to shake up the status quo with unapologetically conservative takes and a whole lot of Southern charm. From the halls of Congress to under the dome, we're exposing the deals, the drama, and the dirt that the mainstream media won't touch. Who's fighting for your freedom? Who's selling out to the woke mob? And who's about to get roasted? No fluff, no filters, and absolutely no time for spineless politics. Just bold Republican commentary, sharp analysis, and enough sass to make the left squirm. So grab your sweet tea or something stronger, and let's dive into the hottest headlines and juiciest scandals rocking the Tar Heel state. This is NC Political Tea, where the truth always gets served.
Hey.
Last days of summer. Trying to get it all in while we can.
Trying to get it all in. Everybody at work's on vacation, so if you're, you're having to do it. And by the way, that's not a commentary on you, my coworker.
Oh no, listen, I had some work stuff I had to take care of. No worries.
Okay.
Starting a little late, but we're getting into it. It's hot.
So look, 2 updates from last night. This is getting to be a huge issue nationwide. I'm going to play this video. It's in the Senate campaign now here in North Carolina, number 1. Number 2, we are now finding that the WHO is, according to Grant Campbell, who's one of the co-authors of the bill, he points to organizations that the WHO has control of actually doing the education, the credentialing. So we'll get into that, but saw this interview. The video, I'll just say from the onset, is horrible. It was given to me by one of the candidates, can't tell you which, but you see for yourself how Michael Whatley, who is in the hunt for Senate in a primary, responded when he heard about this bill.
What's going on in the great state of North Carolina in terms of the economy, how the tariffs have played out, what you're hearing from voters there. And we've gotten word about a new state bill there in North Carolina that apparently allows doctors from foreign countries to practice in rural hospitals without completing a U.S. residency or passing the necessary qualification exams. And a lot of people in your state are wondering, is this going to push out American doctors? Are they going to be doing, questionable surgeries and things? What's going on in your state?
What I will say is this, that the economy is doing better because when President Trump came in, we are starting to see in North Carolina, like every other state, we're seeing the jobs are being created. We're seeing unemployment is down. We're seeing wages that are rising. We're starting to see an economy that's going to tick. That's because President Trump is fighting every single day to deliver for North Carolina and every other state. What we need to make sure is that anybody who comes into North Carolina to practice medicine or any other profession is going to be capable of doing that right, making sure that they have the right licensures and everything else. So
ask
okay, so and then he goes on to say that he will keep abreast of the continuing conversation on the bill.
Answering about the economy is one thing. Talking about what's happening to people on the ground in their health care is another. He didn't really address that. He just basically said, I don't think he did either.
Okay, so Don Brown knew because he went on to OAN yesterday. He took it head on. He made it his signature issue. I'm going to play 2 parts of his interview and get your take.
Be dangerous.
Well, dangerous can be an understatement. First of all, it is true that there's a shortage of physicians in rural areas of North Carolina. I grew up in Washington County, one of the smallest and actually the poorest county in North Carolina. So I know about this for a fact. However, it's like they say you don't cure a headache with a cyanide pill. And the problem with this is twofold. When you laid out some of the lesser professional requirements that are set forth under this bill, they're obvious. The biggest one is you don't even have to be a practicing physician as long as you've had a license within 5 years. So you could find folks who are not licensed. But let's put the entire substandard qualifications issue aside for a moment. Okay. The bigger problem I have here is this goes into what I've been saying on the campaign trail. The problem that we're having is not just illegal immigration, which President Trump has largely shut down at the Mexican border especially, but legal immigration. And when you go back to the...
Exactly. So whatever they want to say about this, the bottom line is that the bill has no cap, right? So we could see 2,000 doctors in 1 year who will also bring each 10 family members.
Well, and he goes on to say in that interview that there are people that are related to these people that could be terrorists that they'll bring in as family members, and that this is not really in attune with what goes on in rural culture.
Absolutely. Look what he says. I love what he says. He gets it. He knows the kind of folks that are on this list. He's done his homework.
Countries that have Sharia origin, there are 21 countries here that are Sharia origin countries that would allow for automatic transfer of these doctors into North Carolina. And we got to have some scrutiny on this. And, they will apply with an H-1B, under an H-1B, once they're offered a job by a rural hospital. And this Sharia practice and this Sharia philosophy is something that's very dangerous. We got to change our legal immigration system to be a little stricter, in fact, a lot stricter on who we're letting in. And are we letting folks in who are adopting and living a philosophy?
Okay, Margot, sorry, I took him off a little bit too soon. But yeah, I mean, what he's saying is, look, there is a mismatch in culture. You're not going to get orthopedic surgeons from Sweden. Okay, so you're not going to. We have a big problem here.
The hope is not a strategy, by the way, is that doctors in England who want to flee what's going on over there would come here, but that's not likely. Same with Canada, which we've had done in the past, and others, Ireland and some of those places that have really good accreditations, but that's not what we're seeing. We're already flooded with doctors from the Middle East and China.
Yeah, right. I mean, this has no restriction on China or Iran. And by the way, we're depending on the discretion of hospital CEOs, hospital who are pushing DEI, like UNC. We're depending on their goodwill. No, I'm sorry. We can't put ourselves in that position. So the second thing is that I came out yesterday and put this. And look, I just want to say from the outset, these lawmakers, we have a job to do, right? It's kind of like we're in WWE. We love these people, as humans, as fathers, as doctors, right? All but Timothy Reeder. I have an axe to grind with him. I don't like him, and Mike Schiesel. Other than that, the people I talk about, this isn't personal. This is the lives of North Carolinians, and it's just a terrible policy. So, with that, Grant Campbell. Okay, again, I've said before, nice guy, terrible politician, right? He makes a hostage video, basically going out and saying, "Let me explain to my colleagues what this is about." And what came out of his mouth was there's two organizations that are going to be overseeing the number one, the education, okay, of these doctors, and number two, the certification of these doctors. And so my question is to all these politicians, if you believe that Iran, Gaza,
China,
well,
Turkey.
yeah, China, right, and Yemen and Syria and Lebanon have
Pakistan,
have a superior medical training and superior credentialing, then it's either a yes or no question. So when you're out on the campaign trail and you see these guys, if yes, then get the hell out of office. And if no, why'd you vote for the bill?
I think what's interesting to me, Sloan, is just in the past 2 days, we've got confirmation of candidates that have come to town meetings or town halls and been hit up with this question. And they actually literally said, I didn't even know what I voted for. We've had admissions by more than senators, House representatives. That is really scary.
We're up to 16 House members who have said they did not read the bill. They didn't know what was in it privately. And 2 senators. The Senate vote isn't recorded.
One of them said it publicly at a town hall.
Look, we pay them to at least read bills, right?
I mean, you got AI. The bill summary could come to you in AI format. What is going on that we have legislators that don't even know what they're voting on?
These are 2 Republican doctors that ran on America First policy. They're doctors. One of them, for the love of Pete, is a medical school professor at ECU. ECU's mandate is to educate more rural doctors for North Carolina.
Well, I say they got their PA school too.
Let's close down the medical schools. I don't want to pay another dime for them. We don't need them now. Now that you can take somebody out of a tent from Yemen, right, that isn't even practicing now, that didn't do a residency. If you can do that, why are we paying for rural health care grants and medical school?
Yeah, I don't take that approach at all. I think, to me, what I would like to see is
I'm being facetious.
I know you are, and I know you are, but I live in rural North Carolina, and I want to take a pragmatic approach, and that would be there are at least 3,000 doctors that don't get matched every year. Why can they not do a side by side with a rural doctor, and they're already gone through medical school? Why can't they be the ones to pick up the slack? Why do we have to go outside of our own country?
They are pissed. My DMs have been blowing up with people, residents, thanking me. They don't really know how to be an activist. They're not doing this to be an activist. They're just keeping their head down and being good students. I'm telling you that Black and brown students who have come from, from disadvantaged zip codes, okay, have properly gotten a leg up, and they feel, rightfully so, that they're going to be to the back of the line once they've incurred debt and they've been the only one in their family to ever become a doctor. It's taking their American dream and flushing it down the toilet.
Well, I have a few doctors in my family, direct family, and there's a reason why they didn't come back to Murphy, North Carolina to practice. The schools weren't as good as they wanted them to be for their children. They couldn't make as much money. And frankly, the scope of practice was not that wide. But they all retired here, and they do contribute to the community when it comes to medicine. And I think those are the people that I look at and say, well, how would you feel if you had to compete against one of these doctors? And they're very upset about it.
Yeah, I mean, it is upsetting, and we're going to go over some lawmakers' responses. But, since we've been hearing from doctors, and I think that's the best, way to learn a little bit more. We have a doctor who is a Philly board certified, proud American cardiologist. He writes on medicine and health policy. And he's going to join us right now and talk about his newest piece and weigh in on what he thinks about this. Because I'm telling you, we really need to get doctors in and to explain this. Dr. Anish Koka, how are you?
Thanks so much for having me.
Thank you for coming on. Thank you very much for coming on. So you're a board certified doc from Philly. What got you into cardiology? What first drew you into medicine and specifically cardiology?
I came here as an immigrant. My father came here to start a software company in Pittsburgh near Carnegie Mellon, and there's just such a vibrant physician community that my parents were kind of a part of their friends, their close friends in Pittsburgh. So I very quickly kind of decided medicine was quite a calling. And then once I got into medicine, cardiology is just a super, super cool field. Lots of physiology, lots of pathophysiology, and of course, lots of disease and a lot of people that need help. So I was drawn to it kind of immediately when I went to med school.
So a little bit of background. I was an ortho rep for 10 years, neuro and ortho. So, spine, knees, trauma, always on the pager. And I saw something called Duraceal for leaks. So I've seen everything. I've seen a cabbage. I've seen, transplants and all that. And I know that obviously when patients are intubated, there's no more vulnerable spot that you're in than that. And so when I first heard about this, because a lot of people will respond, well, heck, if they don't like, this particular doctor, it's a marketplace and they can go to other places. But
it's not that way in rural medicine.
Not that way. And if you're in a car accident and they're taking you to the surgery, they're going to anesthetize you and you don't even know.
No, that's exactly right. That's why you got to be, I think the public really demands that there be some level of competency, some level of qualifications, and something that they can trust. And so, we went through quite, how COVID went in terms of what happens when you lose trust in institutions. And so to kind of go through COVID, go through the pandemic times, go through this lack of trust of institutions that kind of developed with good reason because of what a lot of folks in, institutions were saying. Then to kind of see this I mean, it's hard to see how this doesn't kind of fray that trust in, institutions and doctors, even more.
Well, so this House Bill 67, it does lower the bar for licensure. No U.S. residency, no exams. What do you think the immediate harm patients in rural North Carolina could face if this becomes the new normal?
Yeah, the thing that kind of jumped out to me immediately was that we have such a difficult time, and I think you had a nice piece about this, or I saw a couple X posts about this. We have such a difficult time just in the United States kind of trying to monitor fraud, fake licensures, fake diplomas. There just last week there was a nurse that had been seeing patients for like a year before it was discovered that she was using her partners or some fake certificate and stuff. She wasn't an actual nurse, but she was functioning as a nurse, and it was a coworker that discovered that. It wasn't the nursing board that discovered that. So,
of course not.
That's just one of many stories. So the question, the thing that immediately comes to mind when you're like, okay, so I understand what the intent is. You have a shortage of doctors. You want to get good doctors to come over to the United States to kind of help, take care of folks. Well, the first question is, what's the vetting process? How are you going to do that? And, if you read the bill, it says, number 2, must hold or have held a current active medical license in good standing from a foreign country. How are you gonna enforce that? So we have a hard enough time doing that in the suburbs of Philadelphia, say. Now the North Carolina Medical Board is going to be monitoring a good standing medical personnel in Rawalpindi, Pakistan. I mean, it seems to stretch the imagination they do that. So I think the danger is that either bad actors or malicious actors or whatnot are going to use this as a way to get into the United States, and it's a scary situation. You're talking about vulnerable patients that are in a trauma and they're showing up and they need to be taken care of, and you have somebody who you haven't vetted. So the residency program requirement is a very, very good way of vetting and kind of weeding out folks that are very bad, that should not be practicing here, right? So you have to redo a residency, and redoing a residency is hands-on supervised training of these folks that happens under U.S. licensing, and even then that's not a foolproof system. But to do this, I mean, I thought that was ridiculous.
Yeah, I mean, our medical board allows felons, convicted,
one of 4 states,
sex offenders to keep their license. I pointed out many times I pointed out actually a cardiologist who works in rural health here from Pakistan, and who is literally tweeting pro-terror sentiments about Jews and Christians during the workday, during clinic hours.
Jeez.
And they do nothing about it. So, yeah, I mean, we're in a bad spot here, Doc.
So, Doctor, I have a question for you, though. The question is, you don't really find these things out until after the fact. It's not a proactive measure when someone's hurt or their injury is greater than it was when you came in. How? When they're already here, what can you do?
Yeah, I mean, you have to rely on colleagues, similar to that case I was talking about in terms of the nurse. There's a big reliance on colleagues to kind of identify folks that are practicing that are subpar, and then make those reports. But there was this famous Dr. Death, who was this neurosurgeon. It was, again, U.S. trained neurosurgeon who made it through the system one way or the other, and could not do neurosurgery. You can imagine how scary that is. It's one thing if you have somebody who has no idea what they're doing and they're doing family practice. When you're doing neurosurgery, I mean, you literally are killing or maiming or paralyzing somebody every single time you take them to the operating room. And so, this was a case that was discovered only after colleagues had reported him after, I believe years of him practicing. Mm-hmm. So, he's not practicing anymore, but that was after maiming and paralyzing, a whole host of people, really a tragic thing. And that's going through a U.S. system.
I mean, you can do it in an instant, and you can also hit the wrong, if you're doing a hip replacement, you can hit the femoral artery extremely easy. So, I mean, it is even in wonderful hands, and surgery is where I have the most, I have experience working, because, I've seen it even in anesthesia. And by the way, maybe you can I mean, that is really no game. I didn't see anything in the bill about being board certified. So let's say an OBGYN, in America would have to have a fellowship after, I think, general surgery, right? It would have to have some fellowship. I didn't see that.
Yeah, no, it's this equivalence that they're drawing, saying that, well, if you're a practicing OB-GYN there in another country in good standing for more than X number of years, then you can come over here and do the same thing here. And again, it's just, you got to have a very strong vetting process to make sure that you're not getting folks through that aren't good. And yeah, you're right. And that doesn't seem, it beggars the imagination to think that the North Carolina board is going to be able to do this.
They can't handle what they already have. And my concern is that, first of all, people are finding out and they're outraged, naturally, but they're scared. And my concern is that they push away going to the doctor at all.
Yeah.
Because they don't know what they're going to get. What do you is that possible? I mean, have we
No, again, we saw that during COVID, right? People were so scared to go to the hospitals because of COVID. And, of course, that's not like the pandemic was exploding at every single hospital across the country, right? So there was tons of hospitals, as we all know, that were empty, that were saying, please come if you have a problem. And yeah, you had spikes in cancer, right? Because people avoided going to the doctor and they were found only at a later stage when it wasn't able to be caught, wasn't able to be cured. So no, trust is so important. And so, I struggle to understand. I just think this wasn't thought through. I watched the video you were talking about of the physician in North Carolina, and he was saying, oh, look, if they come here, they'll be supervised by somebody. And look, it is so hard. I mean, again, how are you going to enforce that? How do you not just have like someone who's like 85 who has a license or whatever, 75 who's practicing, and they're just kind of sitting at home and like, oh yeah, they're supervised. How are you going to enforce that they're there, actually supervising that physician, or are they like in another room? Like,
that's exactly what happened. I live in rural North Carolina. Mm-hmm. I called a physician who is almost 80 years old. I said, what do you think about this? He said, I think it's very interesting that they think I'm going to stand and babysit this person. I may check in with them once a day, and this is a very liberal doctor. He doesn't like this either. But I have to ask you, because you're a specialist, and we don't have a cardiologist within 100 miles. We have to go to Atlanta or Asheville or to Knoxville. What do you see when you see folks that are rural come to you because you're a specialist? Do you see them in further along in condition? Do rural patients come in more proactively? What do you see?
No, I think I do see many times folks that are that don't have access to healthcare resources coming in much later on in the stages of whatever disease they have. Sometimes it's good because, of course, there's some of that. There's a creation of demand when there isn't actually demand by having too many physicians. You have too many cardiologists, you're getting a bunch of stuff done. Some of that, but most of the time, what's happening is, unfortunately, especially in rural areas that don't have access to a good physician, you're as a specialist, you're getting to them much later. It's like, man, I wish you'd gotten to me a few years before, so we could, or 5 years before, 6 years before, so we could have tried to prevent and avoid the kind of acute issue that you're having now.
So in your piece, you brought out something that scared the hell out of me, and it's diploma mills, basically, in foreign countries.
Yeah.
Will you tell us about that?
Yeah, it is so competitive. Look, again, I'm was born in India. I came here when I was 10 to the wonderful town of Pittsburgh. I just moved my college-age daughter into University of Pittsburgh, so I was back there. I was back there a few hours ago. That's why I was talking to you guys over DM.
I'm going through that next year. So
oh no!
Yeah.
Oh no! All right, have the handkerchief ready. But yeah, it's certainly an interesting. An interesting. Remind me, what were you asking? What was the question again? Give me the question again.
Yeah, these diploma mills.
Oh yeah, the diploma mills. Yes, sorry. Yeah. So my background, I was like, where was I going with that? Yeah. So my background is, growing up in India. So I obviously have a lot of connections to India still. So it's so competitive to get into medical schools and to get into higher education in India that it's a 0.5%. You have to have like the difference between a 99.2% versus the 99.7% is sometimes determining whether or not you're able to get into a certain profession or not. And so because of that, there's a big incentive for cheating, corruption, paying bribes to get tests. And so, in the article that you're mentioning that I wrote in Substack, it happens periodically that these exams, it turns out, that are being used to decide on competency or not, and decide whether or not you become a doctor in India, or not just singling out India, but other countries too. It turns out there's some big scandal. And, so it's not just diploma mills. It's like, okay, there's a big scandal and you have people that have a fake amazing score, right? That's been discovered. So, and then the separate issues, of course, even worse. Then there's diploma mills, right? You have like folks that can just pay to get a diploma. And that happens too, because there's, again, such a demand for these type of things in places like India. So yeah, it's a really, really significant problem. And I think it's just a very, very, harebrained approach. There's just not a lot of thought that went into this. I mean, just ask I think there's a ton of international medical graduates who are here, by the way, it's a slap in the face of international medical graduates who came here, did another residency, right? And they'll tell you that. If an international medical graduate is being honest and being objective, they will tell you that, look, you can't just take anyone here just because they say they have a license there, and because they, show a certificate. I mean, so there's a bunch of different issues.
Yeah,
that the current system's catching.
They're mad.
If you had some suggestions to make, aside from we would love some lobbying at the AMA if they would even take this on, what suggestions could we do in the U.S. to proactively get doctors in rural locations with incentives, good doctors that are American doctors? I don't care if they're from Canada because they have the same standards, UK, doctors that have the same standards. What kind of incentives do you see that we could use?
Yeah, I spoke about this in my Substack piece as well. I mean, this whole Band-Aid completely ignores the root causes of why it is you're having these physician shortages, especially in rural areas. The reason you've kind of decimated independent, because it was a lot of independent solo practitioners, these family docs down the road and stuff, and those folks have been destroyed, especially after Obamacare, because you had all this massive amount of regulations, that an administrative overhead that now needed to happen. You needed to keep records of this. You needed to have an electronic medical record. You couldn't just walk in with a chart, make some notes, and then have a nice conversation about and have a relationship with that patient in the room. The government is very much in the room now with you, and so there's a huge disincentive to be in private independent practice. And I think if you started rolling some of that stuff back, if you started taking away some of the administrative burdens that physicians had, if you allowed other models, there's a model called direct primary care, which is a subscription-based model where you could pay,
like concierge medicine.
Yeah, similar to concierge in that there's a subscription basis, but much, much, much cheaper than concierge medicine. It's where it's $50 to $100 a month where you're paying for access to a physician. And there's these different models that exist that physicians would be very happy living under, as opposed to living under this Medicare, Medicaid model, which you get paid $40 and you have this complex patient with 7 things in front of you. It's like, who the heck can do that? So doctors, independent doctors, especially in rural settings, are being set up to fail. And so, what I would love to see from these lawmakers is actual solutions to some of those problems. It's recognizing those problems. This Band-Aid is it's so bad on so many levels. It completely does not recognize the fundamental problems with what happened in terms of why there's a shortage. And then you just create another problem with this kind of Band-Aid solution. So lots and lots of ideas.
They're pushing back and saying, and this is the wrong approach. They're saying, look, this bill is so good because it's not an either or, it's an all. We did an interstate compact to make it easier for doctors to come here, and we put this international thing there. And I'm like, buddies. What you've done is you've messed up your whole bill because you depressed the wages. So a doctor from Michigan that's been practicing for 10 years, right, is going to demand, I'm just pulling it out of the air, $300K. And then a doctor from a tent in Pakistan is going to want $50K, and this is billable hours. And so the insurance companies makes out like a bandit, and the hospitals. So what they've just done is they've obliterated the intent of the bill, which was to expand a little bit the practice of PAs and to make it easier for doctors to come in. So all of that went bye-bye.
Yeah. And guys, it's like, read the room. Like, the national conversation is what? Don't just import cheap labor and destroy things, destroy the domestic market, right? It's like, I mean, it's stunning to me that Republican legislators in North Carolina are proposing this thing which kind of devalues folks that are here. I mean, and that's the thing that I brought out. It's, look, I'm kind of on the libertarian free market side after having lived through Obamacare, right? It's kind of quite the red pill for me to swallow when kind of I was in practice and trying to run a business and a practice, and Obamacare came out. So on the libertarian side, some people say, hey, look, you should allow the free movement of labor across state lines, across international lines. But the issue is it is so completely unfair to force U.S. citizens, right, to go through all these hurdles, right? It's the acceptance rate into U.S. medical schools is 1 out of 3. So 2 out of 3 U.S. citizens do not make it into medical school. Okay, and then on top of that, you then have to, it's $300,000 to $400,000 of debt you have to accrue as you make it through 13 to 16 years of school after high school, right? And then you get to practice medicine. And now you're going to allow folks to just make an end around, in India, for instance, right? After high school, it's 5 years to get what's called an MBBS degree,
wow.
the MD equivalent degree, right? And then maybe you practice a year or something like that. I mean, in this case, they're saying practice 5 years and then come over. Again, that's if they do it, if they vet that, right? How are they checking all that stuff? So it's still, when they come here, when international medical graduates come here right now, they're coming with close to zero debt, right? It's already, I think, an unfair situation on that front. And of course, then you get into the whole business of the affirmative action debate, right? Which is really crushed in terms of, you're saying, oh, well, if they can't get into medical school, clearly they're not capable of it. I don't know about that, given how affirmative action has really taken hold, right? You have folks that are being selected not based on merit, but being selected because they hold certain, they're filling the right buckets, if you will, right? So I am 100, after going through this whole system myself, 100% convinced that if there is a shortage to be met, which there is a shortage, by the way, there is absolutely can be met by the domestic citizenry. And it's not the case that Americans can't do it. That's ridiculous. And so then, so anyway, I'm talking too much now, but
no, you're not. You're exactly.
I love it.
We absolutely, because how I got onto this story is Congressman Greg Murphy made an ex post, and the thesis was, being a doctor is a job that Americans don't want to do. Therefore, ergo, we need H-1B visas. I mean, that the analogy, it was so flippant. It was almost like you're talking about, a chicken plant worker or whatever. And then I started to pry, and all of a sudden, to my horror, I mean, I'm nosy, doctor. I mean, is there anything wrong with that? I mean, so I started to pry, and son of a gun, the state representative practicing at the same hospital, ECU, in the same town, same congressional district, put this bill up. And I called several of the people I know who are House representatives, and I said, what in the actual? And they didn't remember voting for it because there was a provision that, I'm just going to tell you, it was written by a lobbyist. Okay.
100%. 100%.
But the bigger issue is, here's what's concerning to me as a constituent who doesn't have all the insight that Sloan has from that perspective, because she's literally been following this guy for crazy stuff for a couple of years. I mean, insane policy views. The bigger issue for me is when you call a legislator and you say, how come you voted for this? And they don't even know what they voted for. You're telling them what they voted for. And they're like, that's not what they said. Like, they took his word for it. They didn't even read it. And what was sent to them versus what they voted for.
It's the white coat syndrome in the legislature.
Correct.
Yeah, no, it's really unfortunate. Well, thank you for raising that. I mean, I didn't see this until you brought it to my attention. So, I mean, great work. I mean, that's the thing. Like, if the citizenry isn't paying attention, all kinds of things are happening without you knowing it.
Well,
I have one final question for you, as a rural person who, by the way, I used to live outside of Philly, not quite too rural. I lived out in Downingtown. But anyway, my question is, why would they not separate this out. Like when Australia did this and they really needed doctors in the outback, they said you had to be from Ireland, you had to be from New Zealand, Canada, America. Why would they not make that same kind of designation? Is it because of the DEI thing?
Yeah, no, I don't think so. Again, I don't know. I can't. I don't want to.
Iran and China. How about having our foreign adversaries? Any country that is a foreign adversary or is on a state sponsor of terrorism list, and as you know, if it's not in the four corners of the bill, doctor, then it doesn't matter. So all this after the fact, where they would say, of course, doctors from China can't come in, and it's not in the bill.
Yeah, it's probably not a DI thing because, of course, in medicine, the Indian physicians are massively overrepresented. So it's actually if you're an Indian undergrad trying to get into medical school, it's much more difficult to get in than the underrepresented minorities. I think it more has to do. The reason they're not doing that, my bet is that there's just a massive pool of Indians, Bangladeshis, Pakistanis, from the African continent that are just a huge pool of folks that are being trained that want to get out, and there aren't probably they're churning out massive numbers, right? India is a country of 1.2 billion people, so they're just churning out massive numbers of physicians, and I think that's where the supply is from, and so that's why they're not specifically saying because if they had said we only want Irish folks, they're not going to get that many folks. Because how many Irish?
It's more about the qualifications because of the standard of care. That was what they used when I read about this, and my sister actually did one in the Outback because she's a doctor. But they were really concerned about the medical boards, and they were specified about the medical boards.
Right. There are some fantastic institutions in India that are very good, and I've trained with some fantastic international medical grads from all over India and other places as well. The issue, but the problem is how do you vet that?
Well, that's the thing. It's like, and that's been another argument is that, yes, there are fine surgeons from everywhere. And absolutely. I've had the same primary care doctor for now 12 years, Indian, best in the business, would never go anywhere else. But she actually wanted to be a part of the greatest country on earth and the greatest medical system on earth. And she proved it with the residency and the test. But if you're a great doctor, prove it. Take the test.
Right.
That it's very simple. And by the way, I wouldn't be satisfied if they said, okay, we're going to come back and we're going to mandate the test. I'm still not satisfied with that. I'm not, but prove it.
Or take the test a year later. That's what they have an option to take the test up to a year.
Some tests selected by the medical board. I mean, we don't know if it's like something you'd see in the back of Mad Magazine. We have no idea because it's not written in the bill.
Right. And I think a test is enough. A test doesn't make a good doctor. So that residency training where like you're watching that interpersonal stuff,
absolutely,
communications. I think there's many folks that come in here, wanting to be say X, Y, and Z, but end up doing something else because they're not. It's clear to everyone who's around them that hey, this is probably not going to be where you are. Maybe you should be doing pathology. So it's and how do you and right now and that's not what's happening, right?
If you're doing pathology, you're dealing with limbs. You're already dead. So, I mean,
it's so funny.
It's true. It's true. Actually, I'll tell you a funny story. I'll close with a funny story. At my second day at work, I was, working whatever, and they're playing a joke. And they said, Sloan, go store your lunch in this refrigerator.
I know it was in that refrigerator.
When I opened it up, there were parts. And so that was the gag. But anyway, well, doctor, thank you so much for weighing in on this. I appreciate that you're, cardiologist in a big city, but you have the passion to bring it down to what this looks like for rural healthcare for us.
Yep. Thank you so much for having us on, and thank you for doing the hard work of like bringing this to people's attention because that's so important. So thank you for everything you're doing. It's tremendously important. So good job.
Well, good luck with a daughter in college. Hope you don't get too many calls, Dad. I need money.
Oh, you'll get that. Or you'll get a text message. You won't get a phone call.
No, that's right.
Hey, I'm going to be happy if I get a text message.
That's right. You will be. It won't happen until like November. She's got it weighed out.
Yeah, exactly.
Thank you so much.
Doctor, thank you all.
Alrighty,
Thank
bye-bye.
you.
Well, that was great.
It's great. I mean, it's very good perspective.
Very even keeled too perspective. Very willing to look at it from all like angles.
I don't know how many angles there are to look at it, but I'm going to put up the vote. Well, first of all, let me finish with the WHO. And so, because I'm getting comments about this. So what Dr. Campbell said, let me tell you how it works. So there are two organizations that partner with the WHO, one more than the other, and they're going to vet the medical schools, the International Medical Regulation Memorandum of Understanding. They're going to regulate, and their purpose, by the way, is DEI.
Well, that's why I brought that up.
Yeah. Their purpose is DEI. That's what it is. Whoops. Let me remove that wrong one. And so let me show you the schematic from them and you will see. Okay. So you will see right here, this is from the organization that is going to be taking control of the testing, right?
Yeah.
The WHO implementation plan. See that on the left?
Yeah.
Remember during COVID what the WHO implementation plan was? And we had no authority here in America. We had to follow the WHO.
Yeah.
Now, see,
when Trump has made an effort of saying we're getting rid of the WHO, and here we are putting it right back in their hands.
Now you're going to see column 2, regulatory thought leadership. Why is cultural safety and health equity on the main one? Why is people and culture? What in the actual hell? That is, this is alarming. This is unacceptable. Are we now we're going to be putting part of the vetting and the educational standard of these doctors in the hands of the WHO? To your credit, we didn't vote for that. We voted for getting out of the WHO.
That's right. And our president said he's going to get us out of there.
And did.
That's right.
And now we're back. So here's the vote. So let me tell you what happened. The original bill in the House, and Neil Jackson was a co-sponsor of that bill. Okay. People we like. It said interstate compact. So that means if you're in Philadelphia, you're Dr. Coca, you want to come here, it makes it easier. You're in Atlanta, but you passed your residency, you passed your test, you're American.
You're board certified in that state.
Right. Now, the Senate put in this lobbyist written part. Okay. So what has to happen is that bill has to go, but you're going to hear the bill has to go back with changes to go for a full vote in the House. That's what you're going to hear right now. And this is what Dr. Timothy Reeder, representative from Pitt County, stood up and told his colleagues.
He's recognized. This is an omnibus bill that has a number of healthcare provisions, about 10 different bills. This will update the interstate licensed medical compact, prevent surgical smoke exposure for workers, develop a healthcare workforce enhancement in our community colleges, update the marriage and family licensures, modernize master's level psychologist, update the PA licensure compact, allow pharmacists to test and treat for flu, do a medical compact helping with workforce with international physicians, update
there it is.
the
That was
team-based
glossed
practice
over.
for physician assistant, and develop the pharmacy collaborative practice. I asked for your vote. Most of these have been through the House already.
Except for the big one. I continue.
The Senate had companion bills of the House. I'm ready to stand for any questions. Ask for your green vote.
Now listen.
Further discussion or debate? Seeing none, the question will the House's motion concur with Senate Committee Substitute Number 3 to House Bill 67. All those in favor will vote aye. All those opposed will vote no. The clerk will open the vote. Kyle Hall, aye.
Wait and watch. Did you hear any questions?
No, but I also know that Dustin Hall did not vote for this.
Well, he doesn't vote on a lot of them. So that's not, unless he's needed, he rarely votes.
Well, Jennifer Balkum didn't vote, neither did Neil Jackson.
Right. Well, Neil Jackson had an excuse absence. So watch for it.
Clerk will lock machine and record the vote. 109 having voted in the affirmative and none in the negative. The House
Wow.
has concurred with Senate Committee Substitute
Insane.
Number 3 to House Bill 67. The bill will be ordered enrolled and sent to the governor.
And
That is insane. And guess what? Guess what? Josh Stein did not veto that bill.
oh no, honey. He's laughing his
He got what he wanted.
Let me tell you who's laughing their ass off. The hospital lobbyists, and Josh Stein and the Democrats are laughing their ass off.
You're right.
Yeah. Okay. So some representatives are starting to weigh in on this. They're getting their asses handed to them. This is a guy, Kelly Hastings, out of Gastonia.
He got his ass handed to him at a town hall.
Well, something like that, yes. But he's saying today, well, someone has tweeted, our story, what's going on. He's like, well, who told you this? Do you think we would be that crazy? We just effing heard they're that crazy.
Come on, man, Joe Biden style.
Right. Okay, but this is real lives. And so here's what I put. Now, I don't really drop the H-bomb very often, but I got really mad. Do you this little act you're doing, saying that we're stupid. I mean, do you think that I'm stupid? Do you think doctors are stupid? Real lives are at stake. Then I retweeted. And this is what y'all need to ask representatives. When they're in just ask them. Do you deny that it lowers the bar to the floor for foreign doctors who are going to come to North Carolina? Yes or no? Hear what they think. Are you denying that it relies on the WHO to approve the education and testing of foreign doctors instead of using U.S. standards? I just showed you that. By the way, several of his constituents told me he didn't even know he voted for the bill. Does he know what's in it?
He admitted it.
This guy is it being implemented everywhere, just in the state of North Carolina, Postman?
In rural North Carolina specifically.
Ain't we lucky? Okay, so Benton Sorry is a Tom Tillis Phil Berger plant. He's pompous and sniveling. He's out of Johnston County. He's getting a lot of money too from the Hospital Association. Here's his argument, and I don't think it's going to hold water. This pathway will allow a narrow subset of people. Where does it say in the bill, a narrow subset of people? To provide better outcomes to always. So Benton Sorry believes that Iran, Afghanistan, and Africa have better medical schools or comparable with the U.S.
That's not what I see what he's saying, Sloan. He's basically saying that the rural doctors we have now, if you put that back up, are not doing well, and they'll do better with foreign doctors. That's what I read.
Oh, okay. So the American doctors aren't cutting it.
That's what I read there, don't you?
Now that you mention it, wow. Okay, so what we have isn't cutting it. Okay, well that's not great. And then he says, this is about supply side reform. Buddy, making this an economic problem ain't gonna cut it. To have better.
Listen, we border Georgia with a medical college. We border Tennessee with several. We border Florida that has. We don't border Florida. We border South Carolina. Why can't we get our supply from around us instead of outside of the country?
Well, treating this, I'm just saying. I'm also a political consultant. So when I see this, and someone would say, "Hey, should I put this out there?" I would tell my client, you're treating this as an economic, as a supply side thing, as an economic problem. Shut up. And right now.
I'm not a consultant, and here's what I'll say as a constituent. When you talk to rural voters and constituents in your own area like they're dumb, you piss them off. And when you put down the fact that you don't think that what doctors are doing now is good enough, that we need to bring out in doctors from overseas, you make Americans look bad.
This guy is an America Last traitor. This is a socialist tool.
But I'm going to find out.
Yeah. Listen, my phone, your phone has been ringing off the hook. There's never been a better time to primary a sitting Republican right now. And I'm the primary specialist. Give me a call.
I've just been getting calls from people who donate money saying, who do I not donate to?
Oh, yeah. Yeah. That's absolute. So they're trying to handle it this way. Right now, here doctors are weighing in. This is a doctor, and he has a talk show, very influential. And so he listened to Dr. Grant Campbell. He listened to it and he says, I agree that he's using these ex-U.S. organizations cover. There needs to be one standard for physicians in the U.S., both domestic and foreigners. We need to train enough physicians. I think that's reasonable. Dr. Johnson said his statement makes it worse. You're using foreign organizations to decide what's safe for Americans, but you don't even know what they mean. We have standards and safe medical practices in America. This bill is going to harm American citizens. This is another guy. He doesn't use his real name, but he's a doctor. And again, he represents independently owned medical clinics.
Look, he put bovine excrement up there.
He put, this is the dumbest bullshit I've ever heard. North Carolina Republicans are not Republicans. They despise small businesses, including independent medical practices. Doc Speaks weighs in again. There's also no real requirement that they completed any postgraduate, if they've been working for 10 years, after 4 years of working in the underserved areas, they're free to apply for unrestricted license. They can go anywhere in the country. That means this is not a solution for the underserved areas, but a way to bring in low wage compliant physicians. It's HB1 gone wild. This guy says they sold out their constituents as doctors. They should have known better than anyone. This solution is bad for patients. This guy, these two doctors had not practiced medicine outside the USA, unlike me, don't hold 3 international licenses. So this is really dumb, putting lives at risk. This is interesting. This is a physician born in America, got my medical education in America, graduated over $350K in debt. And now you're telling me people from overseas can just come in and not take one of the hardest exams ever and practice here? Please do not cheapen the profession.
Wow.
I mean, the legacy that Dr. Grant Campbell is leaving in his first,
term.
It's
So,
terrible.
Here's my concern. Where are all those congressmen that were all America first? Let's not let all these people in. Why aren't they weighing in?
It's interesting that you mentioned that, because Benton Sari he is the senator, the state senator for Brad Knott, and I'm going to have to remove that. So Brad Knott wrote a story. I don't have it, but he's been very strong on the issue of North Carolina has more illegal immigrants than Arizona.
Correct. I saw that story and he was surprised by it.
He's surprised by that. He's going to be very surprised at this. Look, I mean, in the first 2 years of this program, we could easily take in 2,000 foreigners, right, from hostile nations, plus those 2,000 bring 10 family members. That changes the complexion of this state. PJ,
I love rural areas.
Yeah, I love him too, but there's a problem. See, here's what happened in the UK. 2 things. They would bring in these, a group of 500 Pakistani, mostly males, into towns that only had about 4,000 people living there anyway. And it would terrorize these towns. That's what's happened. And so, and don't forget, 60% of crime in the medical industry is done by the foreigners they've had to bring in. This is a real problem we have. We've just turned it into the UK. We have turned into the UK and the NHS in one fell swoop. And you do have senators out here who are bullshitting around. They think it's a game and they think it's a joke, and most certainly is not.
Well, the bigger concern is the last statement you made that really resonates with me. Changing the culture and the demographic in rural North Carolina, which is, of course, mostly conservative.
They are. And that's true. And then I got to thinking too, look, let's just say that you've got a single mom, 3 kids. I mean, it's hard. I mean, it's hard not being a single mom and having 3 kids, but who goes to the doctor. Doctors from, Gaza, totally different set of values. And the doctor does something very inappropriate or very horrible. Now, when she goes to complain to the hospital board or whatever,
Oh, we know what happens.
who are they going to believe?
Not generally not the patient.
They're going to believe a doctor or just a single mom. So there's already an imbalance of power, and a foreigner can come into this country and have more rights, more power, more steam without earning it.
That's sad.
That pisses me off.
Me too.
So to wrap it up, here's where we are. A week from today, the General Assembly gets back in. My advice is fix this. Look, they could do, I guess, something in the budget where they could, I'm just throwing it out there, do some sort of remittance tax that makes it twice as expensive to hire one of these doctors as an American.
They're not going to do that. They're going to end up in a legal challenge. That's what, and you know that the sad part about a legal challenge is that we know lawyers and judges are going to lean on the easy way.
I can tell you, this is going to be a very, very bad midterm.
It is going to be a bad midterm,
and they've earned it.
Absolutely, they have. So if you're interested in about maybe running against one of these folks, just
we're here to help. Look, I play to win, too. When I commit to taking somebody out, it pretty much gets done 80% of the time. In politics, there's no guarantee, but I'm going to put my shoulder to the wheel and make sure that some of these people are out. And I know that other people are too. Look, I mean, we are the grassroots, and a lot of the candidates we were talking about ran, and they're serving their first term in office. They say they are the grassroots. That's how they actually got into their office. We put you in, we can take you out. Your obligation is to read these bills. Your obligation is to protect us. You failed. You failed. Really pisses me off. I mean, so they need to fix it immediately. And if I were them, I would stop bullshitting around saying that, oh, this is hyperbole.
Defending your actions with arrogancy only makes you look like an asshole. And when you do it to people who live in rural North Carolina, that's even worse, because we already know we have to drive somewhere to get good care when it's care for very special things. But you're talking about ER doctors, family practice doctors, orthopedic surgeons when they're needed. But you're defending something that we all know is going to hurt someone.
And we're going to have doctors on, and you're going to have to explain it. Look, people will believe a doctor who is board certified, in earnest, concerned about it, especially one that we're going to bring foreign doctors on who have played by the rules, and they don't like this at all.
They shouldn't like it.
And who are they going? Who are people going to believe? I could run. If I were running a campaign, I'd run on this one issue.
If you want to run in rural North Carolina, which has a lot of representatives who have been in the state spots for a long time, now's a good time.
Oh, House 39 in Eastern Wake.
Is that Mikey's?
I think so. Is it Eastern Wake? Is that 39? Eastern Wake. Eastern Wake would have to be right. Okay, so there's 2 Republican reps here. Look, we're not your problem. So you need to stop pointing at Margot and I. We're not your problem. We're not your solution either. But you better
deflect. Be a big boy. Don't deflect. Act like a big boy.
This needs to be changed, and this needs to be changed right now. Look, people were going out there and saying, well, no bill is perfect. No, son, what you need to say is nobody is perfect, and I messed up. That's the right approach.
Because we're going to remind you. Trust me, we're going to remind you if you come on the trail. We'll let everybody know to remind you.
This is going to be the number one issue. Remember, primary voters are by and large, I think they're 65 to 67. Someone corrected me today. This will be the only issue for them. You know, my mother-in-law has been here for a few days, and she's from Israel. But she brought up this excellent question. She said, Sloan, what I want you to do is look at what happens when an American doctor wants to go and practice in the UK.
Exactly.
They have to take a test. They have to do, I believe, some residency. What happens when they want to go in China? I mean, the hurdles are immense. So this America Last approach is so offensive.
It's everything we voted against. It's the antithesis of what we voted for.
Yeah. And now I'm afraid they've done it to themselves, and all the good work that they've done has been wiped out with this one provision that an increasing number of reps are admitting to me, to you, to others. They didn't even read. They didn't even know. And I put up Tim Reeder. And if you're sitting there and you didn't read that bill and you voted, I can see why you voted yes, because he just glossed over it. I feel like he lied.
But you need to fix it. Well, I mean, listen, I'm all about like everybody makes a mistake, but fix your mistake.
Yeah, no more talking. Shut up. Don't go on the record defending this like Mike Schiesel, making us the problem. Fix it. Lives are at stake. This is your legacy. This bill will be the legacy of every single lawmaker. And by the way, Democrats will be voted out because of this also. This is not a partisan issue. It's just a complete shock that it came from Republicans. Complete betrayal.
I need to go get something to drink. It's just so much.
Bye, y'all. I'll see you Thursday. Okay.
See you.
Bye. Hang on. And we're out.
That's a wrap on today's NC Political Tea. We hope you're leaving sharper, spicier, and ready to take on the political craziness in the Tar Heel State. If you loved what you heard, or even if it made you mad, don't forget to subscribe, leave a review, and share this show with your friends, family, and that one coworker who just needs the truth. Follow us on social media to stay in the loop and get your daily dose of conservative fire. And remember, here in North Carolina, the grassroots grows stronger when we stand together. Until next time, keep the faith, keep up the fight, and don't let the left water down your tea. This is NC Political Tea, where we spill it like it is.